Do you have pain when you poop or after you poop? You might have an anal fissure. Watch this video to see why. This is a diagram of the physiology of an anal fissure. It's quite complex, so we'll break it down into various steps. The first thing that happens is trauma to the anoderm. Anoderm is the lining of the anal canal. This trauma or damage can come from a hard stool, frequent diarrhea, heavy wiping, or trauma, for example, from an enema or some other means. This sets up the start of a vicious circle, which keeps cycling over and over. The trauma to the anal canal or lining of the anal canal results in pain. Patients report that this pain can be cutting or tearing or ripping, or they'll report, for example, that it feels like they're pooping glass. This pain can be some of the worst pain that the patient has ever felt and becomes progressively worse throughout the cycle. This pain leads to internal sphincter spasm. The internal sphincter is not under the patient's control. It's an involuntary muscle. This spasm leads to, guess what, more pain, beginning the start of a vicious circle. Again, this pain can become more intense with each bowel movement with each day and just feeds back on itself. It's like a reflex. Sphincter spasm leads to decreased blood flow or ischemia to the muscle and the tissues, specifically the lining of the anal canal or anoderm. This decreased blood flow is hard to deal with and hard to treat with either medical means or surgical techniques. The decreased blood flow or ischemia leads to more pain. This pain is a little bit different than the previous pain we mentioned. It's difficult to eradicate. It's difficult to treat with either medical means or with surgical techniques. This pain is a deep-seated pain and often lasts for hours after a bowel movement, making it difficult for the patient to deal with. This decreased blood flow or poor blood flow, also called ischemia, leads to more trauma. More trauma is resulting from the poor blood flow because it's hard for the lining of the anal canal to heal with poor blood flow. This is one of the tenets of any surgical procedure or any wound. You need blood flow to get things to heal. Again, now we're setting up a vicious circle. So the vicious cycle of an anal fissure is very, very complex. Treatment plans should be directed at breaking up this vicious cycle. There's certain steps that can be treated by various means, either medical treatments or surgical treatments. Stay tuned for a future video to talk about treatment of anal fissures. We've just gone over the physiology of the way fissures start and why they hurt. Based on this pathophysiology for fissures, we can outline a treatment plan. Stay tuned to Colorectal Surgery Services TV for other videos to learn about how we can go about treating anal fissures with surgery or medicine. Again, stay tuned and subscribe.